Welcome to the Trach Station. Today we're going to talk a little bit about the things that you need to know about a trach patient, how to suction them, and how to provide care. So the first thing we're going to talk a little bit about is what you need to know. So if you have a patient with a trach, you definitely need to know the kind of trach, the size of the trach, and whether or not they have an inner cannula. So as you can see here on this trach, you can see the type of trach and the size of the trach. We can also see that this is wide open, so there is no inner cannula here. An inner cannula trach looks like this. So you can see that there's an inner cannula, kind of like a tube within a tube here. So you can pull this out by anchoring the trach and just popping it right out. We never want to put a dirty inner cannula back in, so we do need to clean that. This is a little harder to see the type and size of the trach, but you will have a dressing behind there so that you can see it. So all trachs can tell you the size and kind. What you need to have in the room for a patient who has a trach. This is really important for a patient who either comes in with a trach or a newly placed trach. So you want to make sure that you have a spare trach, the same kind and size that the patient has at the bedside. If they have an inner cannula, you also want to make sure that you have a spare inner cannula in the room. Respiratory will be able to provide you with all of these. You also want to make sure that you have a spare suction setup in the room, suction catheter tray, I'm sorry, and also suction. Because in case of an emergency, you want to be able to just grab your kit and be able to suction your patient and not have to waste precious moments running back to the supply room. You also want to make sure that you have a clean suction setup at all times and that you test your suction at the beginning of your shift. You also want to make sure that you have an ambu bag in the room. This is a change for inpatient units because typically our ambu bags are just found on the code card. But if you have a trach patient, it is really important to have that ambu bag in the room that you can easily grab in case the patient goes into distress or arrest. You also want to make sure that you have an extra trach mask in the room. Your patient may come in on room air. We do have chronic trachs that come in who are on room air, but when we do suction, we want to make sure that we hyperoxygenate them with a mask. So respiratory can also provide you some of these. So when we get into suctioning, what do we want to have in the room? Well, certainly we would want to have our suction catheter kit. So what we're going to do is pretend like we're going to suction a patient. So before we suction a patient, we want to hyperoxygenate them for at least 30 to 60 seconds. And the reason being is because they won't be breathing while they're being suctioned, right? So we want to make sure that they're good and oxygenated prior to. Also, when we suction, we don't want to suction for more than 10 seconds. And suctioning can be continuous or intermittent. Once we're done suctioning with that first pass, we want to go back and oxygenate our patient again. The recommended time is 30 to 60 seconds. I wait until they're relatively recovered. If you've never suctioned a patient with a trach before, they're going to turn red, they will start bucking, they may start trying to cough and gag, and they may even start to cry. So you want to give them ample time to recover before you go in for that second pass. When you're all done suctioning a patient, you want to make sure to dispose of the dirty tray and then get a clean one for your room. So let's take a look at what's in the kit. So when you open up your kit here, you're going to get sterile gloves. You're also going to find sterile water, and you're going to find your suction catheter. The suction catheters in the kits are 14 French, but we want to make sure that we get the right size catheter for our patient. So anybody who comes in with a trach size 7 or larger, a 14 French is just right. If they come in with a size 6 or smaller, we need to figure out what size catheter we should be suctioning with. So typically how we figure that out is we take the trach size and multiply it by 2. So say a patient comes in with a size 6 trach, they're going to be a 12 French catheter to be able to fit inside that trach appropriately. All right. So suctioning is a sterile procedure. I do equate it to the same thing as inserting a Foley. So you are going to have your sterile hand, which should be your dominant hand, and that's the hand that's going to thread the catheter. And then you're going to have your dirty hand, which is your non-dominant hand, and this is the hand that you're going to use to attach to suction and also perform that task of suctioning out. So when I open up the kit, I'm going to don my sterile gloves, which have been used and abused, so we're going to pretend that I've donned sterile gloves. Once I'm fully sterile, I'm going to come and remove my suction catheter, and some folks take this right out of the bag, but for me, I like to keep it in the bag because it gives me a little bit more control, and I pull the connection piece out. Then I also pour my sterile water in, and I get ready to connect. So I'm going to come over. Again, my dominant hand is going to hold the suction, and my non-dominant hand is going to turn my suction on, connect my suction, and then I just let it flop, and I'm still sterile with this hand. So what I want to do is first I'm going to suction up some water to make sure that I lubricate my suction catheter, but also to make sure that my suction is connected and working appropriately. So then what I'm going to do is I'm going to thread the catheter in without applying suction until I hit resistance. Then I'm going to twist and pull the suction catheter back, paying extra attention around the end of the trach here to clean that out. And then I give my patient a rest. If I want to go again, I simply suction up more water, and then I can go ahead and suction my patient. All right. Oops. There we go. Alrighty. So, next step here is we're going to perform some trach care. So what do we want to do here? Well, we want to make sure that we can get our hands on a tracheostomy care kit. And if you don't have a tracheostomy care kit, no problem. We just need to gather a few supplies. So what you're going to need is a set of sterile gloves. Although this is not a sterile procedure, we do need to make sure that we remain as clean as possible. We also want to get some normal saline, some sterile 4x4 gauze sponges, some sterile drain sponges, a small sterile container to be able to put our normal saline in, and some cotton tip applicators. I always recommend grabbing a few cotton tip applicators as well as the tracheostomy care kit, only because the care kit only comes with 2 and you may need more. All right, so you want to make sure that you're performing trach care every shift and as needed. I will say that you don't need to replace the ties every time you do care. However, if they are soiled or soaked, you definitely need to replace them. Trach care should be done with 2 people, one person to anchor the trach and the other person to provide care, because one good cough without paying attention and that trach pops right out, which is an emergency. If your trach does pop out and your patient goes into respiratory distress or arrest and needs to be bagged, it is the recommendation of our respiratory team at this time to go ahead and bag the patient as you normally would, making sure that trach is covered. So again, it's a 2-person job. If you know that the patient comes in with a fully inflated cuffed trach, you just detach the mask and attach it right to the trach to be able to bag. But please do not do that unless you know that that patient is fully inflated and cuffed. All right. So, in talking about care, I'm just going to get this mask a little bit out of the way here. Okay, so what do we want to do first? Well, if we are changing ties with care, before we do anything to the patient, we want to slip the new set of ties right behind the patient's neck and kind of let it drape over their shoulders. And the reason for that is that we don't want to be all done care and realize that we need to change the ties, and we're going to have to lift the patient's head up, kind of maneuver them a little bit with an unanchored trach, because that will increase the risk of it falling out. So with clean gloves, you can go ahead and remove the patient's dressing. You want to make sure that you anchor that trach and wiggle the dressing down to remove it. You never want to pull it forcefully down. The dressing could get stuck, fibers could rip. It will cause a lot of problems. So then what you want to do is we want to get ready and provide care. So in this kit, you're going to find a set of sterile gloves. So let's say I've donned my sterile gloves. You're going to find some sterile water. You are going to find gauze, drain sponges and 4x4 gauze. You're going to find a towelette, and this we do want to put over our patient because they are going to get wet. This is kind of a rigorous process here, so you want to make sure that they're draped as best as you possibly can. You're also going to find hydrogen peroxide. We used to use hydrogen peroxide and saline to clean the patient's trach site. However, that's no longer recommended, so you can just take this hydrogen peroxide and throw it right in the trash. You are also going to find these little glorified Q-tips here to use for trach care, but this is really why I recommend getting a second set of cotton tip applicators. And you're also going to find trach ties. They're kind of emergency trach ties if you needed them, but we can toss them because you will have new trach ties behind your patient. So what are we going to do? We're going to get our sterile gloves on. We're going to pull out our gauze. We're going to pour some sterile water in here. And the first thing that we want to do is we want to dip one of our cotton tip applicators into the water. And then we want to make sure that this trach is secured, and you're going to kind of go up, down, all around, twist it as best you can to try and loosen up all those dried on secretions and that dried on mucus. You can do this as many times as you need to. When you get a dirty cotton tip applicator, you need to get a new one. Okay, so that's why I said you could go through, 4 or 5 of these, which is why you want extras. Then from there, when inevitably you can't get all of the mucus off, you're going to take a 4x4 gauze, wrap it around one finger, dip it in the saline, and then again, anchor that trach and try and scrub as best you can all around underneath. From there, you want to take a dry gauze and kind of do the same thing, wrap it around your finger and try and dry as best you can underneath, up and around. It's not going to be perfect, and that's okay. So then what we want to do is we would remove the towelette, and we're going to put a new drain sponge on. So just like we took it down side by side, we're going to put it back up side by side. So you're going to slowly kind of shimmy the drain sponge underneath while anchoring that trach. Again, if you have a second person, that's better. And then once it's underneath, you want to make sure that you kind of get rid of all the lumps and bumps and cover all of the skin as much as you can. So if you are changing the ties, again, second person is really recommended here. This is where we tend to lose most of our trachs. So you're going to make sure that trach is anchored, and then you're going to pull one side of the trach tie off and replace it with a new tie. So this is why we need a second person, because if you can kind of see, I'm tilting my fingers one way so that I can thread this through. If you had a second person, they could anchor it down and you could use both hands to thread it through. Okay. So then we're going to move to the next side and do the same thing. And this is why it's really important to make sure that trach is anchored, because we have one side tied with one tie, one side tied with the other. So essentially this trach is loose. And of course my mannequin is small, so the ties are right behind him all the way. So you want to pull so that it's snug, but you also want to be able to fit 2 fingers underneath that trach tie. We don't want it too tight because it could cause pressure injury to the back of our patients' necks. So even if you're not performing trach care, you do want to make sure to assess those trach ties at the start of your shift to make sure that they're not too tight, but also to make sure they're not too loose, that the trach would come out with a good cough. And I think that concludes our trach station. Thank you.